in the bottom of my back.
Okay.
I also suffer with, like my head's in a permanent clamp all the time.
Okay.
Pressure
So
in
you
my head,
feel like the whole head is like in a
I
clamp?
can't
Or
touch the back of my neck. It's been like that for 16 years. They've done all sorts, but never found.
Okay. What do they say about your lumbar back? Are they saying
They've done
sacrum or lumbar?
scans. They've done scans. Everybody's got different opinions, but basically,
Okay.
it's always been tight from a child.
Okay.
I'm very flat-footed,
Uh-huh.
very straight-backed.
Okay. So, and the pain is where?
Here.
Oh, she's pointing sacrum. Okay.
Sorry.
Sacrum and occiput. Okay.
All my head is just like that all the time, permanently.
Okay. Craniosacral person. Okay. Anything else?
I've got a muscle problem at the bottom of my left foot, so it's very painful to press on my
Like
heel.
plantar fasciitis?
That's it.
Okay. Okay. Anything else?
No, I don't think
Anything in your medical history?
in the
Medical history.
No, I don't think so.
Okay.
Not that I can think of.
Okay. Okay.
My mum it said about childhood, I used to get a lot of bronchitis, but
okay.
my mum was a very heavy smoker. Since I've left home, I've not suffered with that. So.
I think many of us don't suffer from many things when we leave home. So, but no, I understand. And then this you remember as a child, sorry, the sacrum you remember as a child.
Even from a young age.
Right, but this is just the last 16 years.
Yes.
Okay. How old are you, if you don't mind my asking?
I'm 55.
Okay, so around age 39, 40, you started feeling this.
Maybe, actually, I think it was younger. Maybe it's going on 20 years I've had this.
Okay, I was just trying to get an idea.
MRIs, nothing.
Okay.
They wondered if a bit of my artery was being nipped a bit, because I have to worry how I move my head. I have to be careful how I move my head.
Okay. Oh, you mean if you go...
Yeah, if I do that, I go...
Okay,
really
that's
dizzy.
typically basilar artery insufficiency. One of her arteries is being clamped.
Just fractionally, but they've never discovered it.
Because this symptom of, you know, when you turn your head quickly is a symptom of the basilar artery being congested.
Mm-hmm.
So that's why, I'm assuming that's why they're saying it. All right, let's put you face up.
The whole of this is like, and I can't bear anybody to touch my neck at all.
Okay, I will do my best to touch it as little as possible.
Okay.
Just so that, okay, but if you turn your head from side to side, you feel something?
Yeah, I go all sort of dizzy.
Yeah, that's typical basilar artery. Okay, let's put you face down. This is for your head. Face up, face up.
Face up.
Sorry, I said face down. All right, hold on. Is this painful? Or should I go further down?
A little bit further down, I think.
Okay. Relax. How about here?
Yes. Maybe just slightly to that side. Sort of in there, yes.
Yeah. Okay, I have it. Okay.
Can you manage? Do you want me to take them off?
I can totally manage. All right. When I press here, you just feel my fingers, right? Mm-hmm. If you feel something else, something more than my fingers, let me know, okay? Anything different?
When you pressed the first time, I felt a slight little bit, but I don't know if it's just from you pressing like that.
Okay, let go there. Is there something uncomfortable here?
Not really.
Okay, that's okay. How about here? Just tell me what you feel. Don't think about it.
Anyway, since I've had a hysterectomy, so it's always slightly tender inside.
Oh, okay, fine. Anything? Okay. Here you didn't have a hysterectomy.
No,
Another
that's
Ren
very
12 cold and very tender. Okay.
I get a lot. This is always very tender in here.
Okay.
Sorry.
No, it's okay. So very tender when
Yeah.
I press. Okay. How about here?
Not a little bit, but not so
Okay,
much.
a little bit.
I
and
forgot about this.
That's okay. It's okay.
In there.
Okay. I'm just very lightly. Okay. Can I take the hair up?
Mm-hmm.
Okay, that's good. Okay. No, don't help. Don't run away. Okay. Is that uncomfortable?
Yes.
Okay. I'm literally just going like this. You know.
Yeah.
Okay. And that's uncomfortable. Okay.
Yeah. Sorry.
Okay. No.
Yeah. Mm-hmm.
That was test. Okay. Ren 12. We're not sure about the lower abdomen, but we will be sure in a second about something else. Anything here? Yes.
Yeah, a little bit.
Okay. If I may. How's now?
Yeah, it's less painful.
Okay.
That is
Stomach 13 for visceroptosis. They took the uterus out. They didn't fill it in with something else.
yeah.
Okay, so everything is falling down. And when was the hysterectomy?
2 years ago.
Oh, only. Did the neck pain get worse since?
No.
Why did you have the hysterectomy? Did you have fibroids?
Yes.
Okay. I'm just hoping that, there's also a chance that this, because it's not since hysterectomy you gained weight.
I did have weight, but I was a lot slimmer. But since my hysterectomy,
It's much, okay.
I've put on about 4 stone
Wow.
in 2
Okay.
years. Yeah, I've put on a lot
Complete
of weight.
hysterectomy?
Yes,
Okay.
and I hate being overweight, but
Yeah, no, yeah. Here? Discomfort?
a
Yeah.
little.
How's now?
Yeah, a bit better.
Okay. I'm just curious, sorry. How's now? No change.
No, it's still very, very tender.
Okay. Next. The plantar fasciitis is left side, right? You said?
Yes.
Okay, where is it? 1, 2, 3,
It's
4.
right on the base of my heel.
Oh,
Right in my heel that I get the pain. Right in there. Yeah,
okay.
right in there.
I believe that's more likely to be a bone spur. Right in the middle of the heel, right? But it could be plantar fasciitis. So hold on 1 second. Hi, how's now?
Yeah, that's a little better.
How much is a little better percentage-wise?
Do you want to press again?
I'm happy to press again.
Yeah, it's still painful.
But is it better at all?
No,
Okay.
probably not.
Okay, probably not. Okay, no
Not
problem.
better for kidney 7.
Kidney 7, yeah. Hold on. Okay, it's here, right?
Yeah, right in the middle.
Okay. How's now? That seems better. You're not flinching.
Yes.
Okay. Plantar fasciitis, so maybe I do agree that it's plantar fasciitis and not bone spur. Plantar fasciitis works very well with both kidney 7, but especially with immune point. Sorry. Seems better.
On that, where you're pressing there, yes.
Okay. How about here?
Yeah, it's very.
Okay, that's uncomfortable. Okay.
Mm-hmm.
Okay. How is now?
Yeah, it's still very, very tender. The worst bit of my neck is slightly lower down.
Okay.
The worst
I'll
part,
find.
sorry.
It's okay. Don't worry. Here.
Yeah. Oh,
Okay. Okay. Oh. Okay.
ooh,
Relax.
Yeah.
How is now?
It's still painful, but maybe a tiny bit less.
Okay. Let's
Yeah.
talk percentages. Make them up. It's okay. 20% less, 80% less, 30%
Maybe
less.
20% less.
Okay, that's okay.
Sanjay 9.
Sanjay 9. Yeah, 8, 9. That is your, it's above 8 and above 9, so it's not gonna be a big
In the
issue.
book it always says Sanjay 9.
Because we used to call above, we used to call 8, and then somebody decided that since it's above 8 and it's above 9, 9 is actually more accurate. But here, the pain.
Tiny bit lower is where I get it. Sort of. Yeah,
Yeah.
in there.
Okay, I got it.
Yeah.
Okay. How is now?
Yeah, that's better.
Better. Okay, it's kidney 9 and liver. Sorry. How is now?
Yeah, I've got a pain. I don't know. Is there something here?
It might be my hand is
right, okay.
pulling around, but sorry, just the sacrum.
Yeah,
Sacrum is better?
That's better.
Okay.
Is it kidney 9 and then?
And liver 8. Basically, I'm going for basilar artery. So I'm substituting for kidney 10, I'm substituting kidney 9 for it. And because I didn't want to keep testing the neck, and drive her crazy, I'm testing against the next best thing I have, which is the sacrum.
But why were you substituting kidney 9?
I generally prefer kidney 9 to kidney 10 for basilar artery, either kidney 7 or either 7 or 9. 1 second.
It's okay to do points on the same channel like that.
Sorry?
It's okay to do the 2 kidney points on the channel.
I'm liver. Yeah, you can do, well, depending which ones, but kidney 9 and 10 would work sort of okay because kidney 9 is not a named point. But I prefer not. Kidney 7 and 10 is, for example, is fine. But the thing is, it's not kidney 10, it's liver 8. It's kidney 9 and liver 8. Okay? Normally it would be kidney 10 and liver 8, plus Sanjiao 8. Okay?
Why would you go for kidney 9, not kidney 7, if it's kind of a bone issue, possibly?
It's possibly a bone issue, but yeah, I that's fair. But for structural imbalances, kidney 9 seems to do a better job. If it's purely bone, we can't. Actually, it's probably not bone. It's probably an artery. That's what they're saying. Is that So she doesn't have a. It's not like she said there's arthritis.
The bone's creating an artery. You think the artery's creating the. Well,
Even if it's the bone, but then it's not erosion of the bone.
no.
The bone may be in the wrong place.
Yeah.
But hold on. You had here. How's that now?
Yeah, that's less.
How much less?
Maybe 50% less.
Okay, hold on. You don't need to move. I'm just bending the ear. I know you're going to want to help me, but don't. Okay. How's now?
Yeah, that's a little better.
Okay. I told you for REN 12, we already did immune. Okay, we already did something on kidney. I can still do stomach chi, but Kawai ear point can be very good for REN 12. And REN 12 is very important because REN 12 is anything to do with marrow, meaning the neck also. Sorry. Where are we at with REN 12 now?
It's probably still at about 50%.
50%, okay. Now,
Maybe a fraction less.
a fraction. Fraction doesn't. No, it's
No,
not
it's
worth a
fine.
needle. How about now?
Yeah, that's it.
That's it? That's it as in 100% gone or 80% gone or?
Or maybe 60% gone.
Oh, okay. Okay. No, it's okay.
Are you doing stomach chi?
Yeah. And now?
It's still uncomfortable.
Okay. Hold on. I don't like this ankle. The way it insists on rotating in.
Yeah, I do. Both of my feet rotate in.
Yeah, but that one extra. And also look yeah. And
I'm flat-footed and I
yeah,
rotate.
and hammer-toed though. So it's
I'm
an
walking
interesting.
more with my left foot. My left
Mhm.
foot, I've got a gait problem.
Yeah. Hold on
and
one
I'm
second.
flat-footed.
How's now?
Yeah, that's a little bit easy.
How much is a little bit easier? How much is left?
Maybe 40%.
Okay, hold on. All right. Sorry, I know it's scary. It was here, right?
Yeah.
Okay, compare. Okay. Okay, remember what that feels like?
Mhm.
And how?
My neck is still probably 80-90% painful.
Okay, so my question is whether pressing here helps it.
No, I don't think so.
Okay, fine. Somewhat.
Yeah.
Okay, hold on. Let's go for mushu. Sorry.
It's okay.
You okay? How's now?
Yeah, that's a little. It probably felt better when you pressed in the middle.
In the middle? Okay, I'll do both. No problem. The other thing is, this is the kind of thing where I can't touch, is like our, reflex sympathetic dystrophy, where the nerves go berserk. There's some original injury that's not terribly big, but afterwards, you feel a little pain, and then 2 weeks later, suddenly you can't touch, and that lasts for years. So, and that's an autonomic nervous system issue, and that belongs to under third toe. So,
What was the name of it?
reflex sympathetic dystrophy, or Sudeck's syndrome, or I believe that nowadays they started calling it regional pain syndrome, which makes no sense at all. Okay. Oops. Relax totally, don't worry. Okay.
And you're treating that because of the area of the hysterectomy?
No, nothing to do with the hysterectomy. The hysterectomy, maybe liver 8. The hysterectomy was stomach 13.
Right.
Lifting it up. Liver 8, cyst, but also part of basilar artery. This is autonomic nervous system disorder, meaning she...
For here. Is that
Well, for here, because I'm thinking like Sudeck's syndrome.
Right.
You okay?
Yeah.
All right. So sorry. Okay. How's that?
Yeah, it's still very, very sensitive.
Okay, no change from at all.
No.
Okay. Oh, wow. Okay, I'm not touching in the back, I promise.
Mm-hmm.
Can you relax here in the front? No. Okay. Her SCM is like, it's like a tendon. It's like a string. Okay. How is the back now?
It's still sensitive. That's maybe a little less.
Okay. That seems less because you're not jumping, correct? Can someone get me a green needle from the back? Sorry, I just can't move the hand because it's...
What you're pressing?
Stomach 9 is best for C4. And that's really where I'm at right now is C4. Thank you. That's perfect.
Just the one?
No, I'll need another one in a second. Oops. Okay. Don't worry. Don't have to help.
So you're just doing that into the SCM?
Yeah, and hers is, it's like a string. Like from the neck pain, she's trying to somehow protect it. Okay.
Yeah, I do.
Yeah, it's okay. It's understandable.
So, what do we need?
I'm going to look at that in a second, yeah. Okay. So sorry. This is our baseline. No, it's like here, right?
Yeah.
Okay, sorry. No. Somewhat better?
Mm-hmm.
Would you try softening your sim first, say with...
Like if I had a tiger warmer, yeah. I already did the kawaii ear point. I could do the ear sanjiao. But let me see what we can do.
But not
Oh yeah, she has a lot of tension here. Thank you. We're doing facelift while we're at it. Okay. Are you comfortable?
Mm-hmm.
Okay, I just want to test one more, if you don't mind. Okay.
Who else?
Touch lower.
Yeah, I know. Here, right?
Yeah.
Okay. Last thing I'm testing. How's now?
Yeah, that's easier.
Hmm?
Yeah, it's a little.
How much is left from the beginning?
Probably 70%.
70% is left.
Yeah.
Okay, I'd like to get more. Hmm?
Stomach 2 or
No, it's UB3 area or something. Hold on. Do 23 area, but
That's a little easier.
that's a little easier. What's my percentage?
60.
60. Okay, fair enough. When you get no results, this area seems to get something. I don't know, Yamamoto calls it something, it's amygdala or something, I don't know. But it neurologically relates to, send some signals. So that's why I'm testing it. Okay. Are you okay?
Yeah, I'm fine.
Okay. Well,
And is that
be
for
with you in a few
anywhere
minutes.
Anywhere in the
Yeah,
body or
pretty
just-
much. Yeah, I think it changes perception is the issue.
So, could I ask you which points they are?
Y-
Either side of do.
It's not exactly do 23 or 24, but it's slightly to the side. And you just have to find, they're not quite defined. He has a whole area
Yeah.
there, like all the other scalp people.
Yeah.
It's always a relatively large area. Or, they say you have 2 centimeters length for this and 3 centimeters for that. What we need to remember for her on the other side is to check L5, which, she has pain in the sacral, not L5. Sacral area, gallbladder 34 or 39. 39 is possibly the one for her, and it will, that's when I'll do Ihikon, continuation of prayer with gallbladder 39, in all likelihood.
What did you say the first thing? Check L5.
L5. Okay. Chances are L5 and T5, possibly T11, 12 are going to be big for her. Okay.
T5 is the main for the neck.
T5 is very big for neck. Yes, exactly. We did basilar artery insufficiency, Sanjiao 8,
Yeah.
kidney 9 as a substitute for kidney 10,
Yeah.
and liver 8. This liver 8 is also for fibroids. She had fibroids, the uterus. We did stomach 13 for visceroptosis,
Yeah.
with the idea of maybe because everything is falling, that's why the neck. We did stomach chi, or stomach 41. And I only did one immune point. Hold on, let me get the other immune point in.
Under third toe.
And under third toe, because I'm thinking it's reflex sympathetic dystrophy. Oh, the immune is because of the plantar fasciitis.
Yeah.
Okay, and then Mushu. Oh, she said Ren 4 did the better job. So let me add the Ren 4. Now we're leaving you to relax.
And then there was stomach 9.
Oh, I'm sorry, stomach 9 and tooth fairy. And then the do 23,
Yeah.
Whatever.
Either side of 23.
yeah.
Like the,
So by the way, a few more.
The stomach 9 and you said the SCM was very tight,
Uh-huh.
but you still went ahead with that.
Yeah, well, I've done what I could to release it. It's like this is a holding pattern that she's not going to be able to release easily. Yeah, this is she's been holding this for 16 years for dear life because she's afraid if she lets go of the front of the neck. That's part of the idea of giving her mushu. It's like if I give her a little bit more support, she may be able to let go here. You can't expect to be able to release it because.
Person maybe for tiger woman.
Yeah, I would definitely, yeah, you know, that or the ear or, yeah, or even just massaging, you know.
Didn't we used to use gallbladder 40 or something for releasing CM or got...
Yeah, gallbladder 40 is good friend of Sanjiao 8. It's a support, but it's a supporting point. It's not the major one. No, totally not.
You go to the Sanjiao 8, yeah, okay, fine.
Yeah, the gallbladder 40 sort of fell out of favor. You know, it came in, say, in 92, and it fell out of favor by 93, 94. So
even if you were struggling, say, like, to get it...
you could try, you could say, oh, wow, supporting point, why don't I try, you know, one more, but it's not so much, you know, it's not like my second nature, it's not my second nature point. Do you know what I'm saying? I don't automatically think of it.
I've tested off an SCM and like Sanjiao 8, it seems to do it very often, the gallbladder 40 is...
Yeah. Yeah, you know, sometimes points come with, you know, sort of like, oh, this is a good pair. So like, you know, say, I'm going to use spleen 4. Oh, I should add pericardium 6 to it, right? So, you know, the gallbladder 40 to Sanjiao 8 is what gallbladder 41 is to Sanjiao 5. You see what I'm saying? So I think it was like this, oh, that sounds like a really cool combination, except it wasn't quite doing it.
That was also just doing it on the left, wasn't it? And you tend to do both.
No, I did both sides.
But for autonomic, you tend to do that anyway, don't you, both sides, whereas the old protocol was just...
For one-sided, yes. That origin was for a one-sided thing. Yes, correct. But that was the predecessor of autonomic nervous system, quite honestly.
And Tia, would the scalenes have been tight?
If the scalenes were tight,
Yeah.
supposedly, you know, then I go through, is it spleen 3, is it heart 3, is it inner yin, is it lung 8, is it all of them?
Injured knee.
Injured knee, left knee?
Long standing.
Okay, left side?
Left side.
Okay.
Yeah. Macular degeneration.
Macular, okay.
Yeah. Pain in this arm, in this shoulder that goes down into the arm. This is the most recent thing.
Okay.
And that's sore when I press it.
Okay.
Okay.
Anything else?
Spondylitis. Very, very stiff neck muscles, especially on the left side.
Okay.
Very tight.
All right. Anything else in your medical history?
I've got 3 stents in. 2 in one place because they made a mess.
Cardiac.
Heart. Yeah.
Okay. All right. So left knee, right shoulder,
Yeah.
the neck.
The neck.
There was something else. Macular.
The
Okay.
eyes,
Yeah. Okay.
Yeah.
All right. Did you have a replacement here?
No.
But you had a bunch of surgeries.
I've had a cartilage removed, yeah.
Okay.
Because it grew a cyst after the injury.
All right. So let's see what we can do. So eyesight is bad?
Due to macular degeneration, wet type, the right eye is no longer able to focus. I've just got peripheral vision.
Okay. Okay. So I'm gonna lift this up. If you don't, can I? Okay. I just need the belly. All right. So, pain here?
Yes.
Okay. When I press this pain.
Not at the moment.
Okay. So when I ask if there's pain there, what I mean is when I press if there's pain.
Yeah, if you press with a finger there, it would be, yeah.
With a.
Yeah.
Okay. This way there's
Yeah.
pain. Okay. All right. And what's this? Just discoloration. This is like birthmark.
Don't know, I haven't seen it.
Okay. All right. Any discomfort? 1,
Yes.
2, 3.
Yeah.
All 3.
Yeah.
Okay. 1, 2, 3.
Not really.
Okay. 1, 2,
Yeah.
3.
Yeah.
Okay. 2 and 3, but 1 was okay?
Yeah.
Okay. So 2 and 3 and 1, 2, 3. Correct?
Yeah.
All right. I'm going to test them again in a moment, so that's why I'm And the shoulder we've seen. Left. Yeah, we're up. Okay. 1, 2, 3.
It's okay when you're pressing now. Yeah.
Okay, not an
It's
issue.
usually when I use the neck muscles, you know.
Okay, meaning turning left to right or something?
Yeah, sometimes it's there all the time.
Oh, God, lower this. Okay. Okay. Relax. Don't worry. Don't try to produce it. Relax. I don't think you're relaxed.
As far as I know, I am.
Oh, you are? Okay. You look like you're trying to do something with your neck.
Oh, right.
Okay. 1, 2, 3,
Yeah.
4.
Yeah.
3.
Yeah, 3 and 4. Yeah.
3 and 4. Okay. That was on the center. How about to the left? 2,
Yeah.
3, 4. 3.
Yeah.
Okay. And to the right? 1,
Yes.
2,
Yes.
3,
Yes.
4. Okay. The right is more. Okay. Now.
At the moment.
Yeah. Okay. No.
Yeah.
It's okay. It's what I find with my fingers. And compare the left side with the right side. The right side is tighter, right?
If you say so.
How do you say?
I don't know. I didn't think there was any difference.
Okay, you don't think there's a difference. Okay, I do think there's a difference, but it's going to be. I prefer if you
Yes,
can,
yeah,
if you
no,
feel,
I
then you can
understand,
tell me
yeah.
if it's better. But it's
Yeah.
okay.
I can
All right.
understand it.
Is there anything uncomfortable here? Very cold navel, by
Probably
the
on
way.
the first one about here.
Okay, tell me as soon as it feels. 1, 2. Okay, Ren 12. Yeah, and it's also very cold. Okay. Anything here?
Yes.
Yes.
Yeah.
Okay. And
Oh, the other thing is I've got prostate cancer.
prostate cancer. Okay. Okay. 1.
Yeah.
Oh, wow. Okay. All right.
That's okay.
Relax. So remember what that felt like? How is now?
It's okay.
Much easier. Okay. When I press here, how is 1, 2, and 3?
They're comfortable at the moment.
They're comfortable at the moment. Okay.
Is that liver 4 or spleen 4?
Spleen, liver 4. Because for stomach 30. Sorry. And how is 2 and 3? They're very close.
Yeah, that one's a little bit sore.
This one's still a little bit sore. Okay, that's fine.
I'm very sorry.
No problem. We'll just let it ring. So, this is okay now.
Yeah, there's some pain there, but not
There is some
big.
pain there. Okay. Next. Liver 9. Cancer
Yeah,
and
that's sore.
prostate. Okay,
Yeah.
so this is sore.
Yeah.
Okay, hold it 1 second. I just want to know. How is the groin?
Fine.
Okay, so I know I should use it, but if I can release it first, I'll do that. Okay. You had here, right? Or here?
Yeah, it's minor compared with the other one.
Okay, yeah, I know. How's now?
That's comfortable.
Okay.
Stomach 30 the other side.
Liver 4 the other side.
What you were pressing.
Oh, stomach. Yeah. Sorry. Okay. Now, you said there is some discomfort.
Yeah.
Whoa. Okay. All right. So the knee. 1, 2, 3 is okay here,
Yeah.
but here 2 is okay. Oh, 2 is not okay, and 3 is not okay.
Yeah.
Okay, so 2 and the outside we still have to deal with. Okay. And okay. And this was with the nail, like
Yeah.
okay. All right. Okay, let me see if I can undo. Okay, if I can undo that. Okay. How is now?
Stomach's fine. Arm's painful.
Hmm?
So
The
your
arm,
stomach's
yeah,
fine,
yeah,
but
yeah,
arm's
the
painful.
arms, yeah. I get that.
What's that?
Immune point for Ren 12.
And you've just needed
I just need.
That was painful, but you...
Yeah, but there's a certain point where you can't chase ever. I mean, it's It's also partially that I don't have a great possibility for this. Okay, so this is okay now?
Yeah.
Okay. All right. Okay, let's recheck your neck. How's here now?
Fine.
How is 1, 2, 3, 4?
Yeah.
Yeah, what? Good?
Yeah. Good.
Okay. Other side. 1, 2.
Still some pain
Okay.
there. Yeah.
2. So one experiment is REN 12 for spine and marrow. How are we doing?
That's fine.
It's fine?
Yeah.
Okay. And next one.
Yeah.
That's also fine. Okay. So we do both. Sanjo 8 and REN 12. And then we'll start looking at the eyes. All right. How does the neck feel to you right now?
It's comfortable laying here, yeah.
Okay. And if you move your head from side to side?
Seems to go further than it did before, but I'm getting pain now turning to the right.
Okay. And is the pain on the left side or on the right side?
On the right side.
On the right side here?
Down the bottom.
Oh, in the back.
Yeah.
Okay. So turning, okay, fine. Hold on 1 second. How is the nail?
I'm getting a twinge, yeah.
You are still getting a twinge.
Yeah.
Okay, fine. Twinge, right?
Yeah, it's still there, yeah.
Okay. Lung 5, how's twinge?
Fine.
Okay. All right. Lung 5, yeah. Lung channel. Shoulder, lung channel.
Oh, okay.
Right? All right. Sorry. Oh, not so painful on this side. Okay.
That's sore, yeah.
Okay.
Yeah.
But not horrible.
Oh, it's not horrible, no. This,
Okay.
this one obviously takes all the weight when I'm doing anything.
Yeah.
So
But this one was
figured it
this
together.
one was worse,
Oh, that.
if
this
I
one
recall.
is-
Yeah.
is-
Okay.
It's really bad, yeah.
Okay. Turn your head again to the right.
Yeah, still sore.
Okay, hold on. And now,
Yeah, still the same.
no change.
No change.
Okay.
We're just testing in the end.
Inner yin, liver 9 because of cancer and prostate, but okay. And now,
Yeah, it's relieved a bit, yeah.
a bit
Not
was,
totally gone,
but enough to just justify a needle.
yes.
At least it was an enthusiastic yes. So thank you. Okay. Is this still horribly painful?
Yeah, it is.
It is.
Pleasant, yeah.
It is unpleasant. Okay. Sorry about that. Just the leg is all I want to know. How is the thigh?
Okay.
The thigh's better?
Yes.
Okay. I know, it's kind of annoying.
The stomach.
Stomach 9. Remember, stomach 9, kidney 11 relate. And he has prostatitis.
Yeah.
So, and stomach 9 is best for C4, C5 also?
Yeah.
Okay.
And it relieves the pain of...
And it also relieves the inner yin. And I'm sorry. Turn your head again to the right.
Yeah, I'm getting pain.
More pain than before?
No, not more than before, no.
Okay. How much compared to the very beginning when you turn to the right?
It's very similar.
So no improvement?
Not at the moment, no.
Okay. How about to the left?
That's comfortable, yeah.
Okay. So it's to the right is still uncomfortable.
Yeah.
All right.
Which is strange because it's always the left that's worse.
Okay. Well, All right. We're gonna. Okay. Just one more experiment, and then we'll see what happens. Okay. Try again.
Yeah, it's clear.
Cleared?
Yeah.
Okay. Stomach 41 is always like your last resort pusher when, for... Oh, I did have one more option, actually. That was a lie. So... Okay. Try one more.
Yeah, still comfortable.
Okay, good. Okay, we'll let you go. We'll just do UB1, UB2 for him. Because enkephalin point, so also for all these different pains.
At what point
Enkephalin point for endorphins. And a little bit for eye. For the eye, it's going to get very complex, so I'm kind of letting go. All right. Yeah. All right, so...
Did this neck pain just come on, or was there a cause behind it that you can...
I think I did it my father had a heart attack, and I was coping in the day, but then when I went to sleep on a night, I've never had panic attacks, but I was actually having them in my sleep, which would wake me up. And I knew by the bed I was thrashing around in the bed, so I think I was coping in the day, but then when I went to sleep, I wasn't. And I think I did it as I was in bed, twisting and bending around and thrashing around, and I'd wake up in panic attacks where I couldn't breathe. But then as soon as I woke up, the panic attacks went, because obviously I was in control. It was almost like my subconscious was going into panic when I was actually asleep, which seems a strange way, because most people seem to have panic attacks when they're awake, don't they? Like moving about.
Well, it's okay, it's what it is.
I just woke up with horrific pain in my head.
So it was just one day. One morning you woke up with this pain, sometime after your father died.
Yeah, and I
Gotcha.
went to the doctors and they just said, oh, it's all stress, it's all this, and then you get this stigma where every time you go back, no, it's just stress.
Yeah.
And of course, no, it isn't stress, this is physical. And after a long while, they then did tests, I saw people and they just couldn't find anything, so then they just put it all down to stress, but I know it hasn't been. And because they couldn't find anything, it was a physio that said it could be that your artery's been nipped a little bit, and the neurologist said, well, she could be right, but there's nothing we could ever do about it. You could have an angiogram, but there's a 2% chance of you having a stroke. And I had younger children. My dad had just obviously had a heart attack. My mum was suffering with depression and dementia, and I'm an only child, and I just thought, I can't deal with this. I've just got to learn to live with it, and that's what I've done for years.
All right. Let's have you sit up.
Has that answered your question?
Yes.
Thank you. So let's have you sit up and walk around, see where the neck is at right now,
Yeah.
and then we'll put you face down and continue. Okay?
Okay.
So
My back feels less painful.
your back feels less painful. Okay.
My head, I'm not so sure about.
Okay. Any pain?
A little, yeah.
1, 2, or 3? 2.
Yes.
Okay. 2. How's now?
I'm not sure if there's any difference.
Okay, that's okay. Now?
Yeah, that's a bit less painful.
Okay. Now?
Yeah, that's less painful.
That's a fair amount less painful.
Sorry?
Which one does the best job? This one versus this one?
The one at my foot.
The one on the foot, okay.
GB39.
GB39 to be turned into Ihijong.
And before that, did you just try
Which may be kind of impossible. Okay. So it's Hijong without the kun and without the. It's okay, not an issue. All right, and sacroiliac.
Is that because of the trousers that you're not putting?
Yeah, because I can't get to UB40. There's no way. No. You already have needles in you. Don't worry. It's fine. Not a big deal. So, anything left here?
I think you're not on the right line. Can you tickle there?
Yeah, you get them.
Oh, hold on.
Fraction.
A fraction's left. Okay. Now?
No, it's not. That's
It's a lot better. Okay. So T11, T12. So I'm basically just going for the places where the spine shifts with the hope that it will, like kind of...
I mean, where you can see that or you can feel it.
Hmm?
Or where the spine normally is.
Yeah. T11, T2, yeah. No. Okay. So, how is this? This you don't like?
No, and a bit lower is where
Yeah, I know.
it goes.
And this is the word.
Yeah.
Okay.
I think it was sacroiliac.
Hold on 1 second. How is now?
Yeah, it's quite a bit better.
Hmm?
Yes, that's a little fraction. It's still very painful, but
Hold on. And now?
yeah, that's maybe a little better.
Okay. No, don't worry.
Which point's this?
T5.
T5.
Did you come back to do 2, or did you?
I didn't get back to do 2 because it didn't help, but I will do it regardless. I also have heart of soul possibility. So sometimes, you kind of have to hedge your bets. So it's okay. So that's why you see more.
So you're doing multiple on T5 because that's the main neck thing.
And because I'm sort of hoping, because with the needle it's hard to get exactly the spots. I'm hoping I'm getting. Okay. How is now?
It's still very tender.
Okay. You have the left heel is bad, right? But the right heel is okay, correct?
The left heel is the one that's painful.
Right. But so this one's okay, right?
Yes.
Okay. How is the neck now?
Yeah, it's no, it's no different.
Not different. Okay, I'm sorry. Hold on. No.
Oh, no.
Okay. Hold on. We'll see what we can get. Let me do 2. Don't lift the leg. I'm going to lift it for you because you have needles in there. Don't resist either. Can you let go? Let me have the leg. You're lifting the leg. You're lifting the... Yes. Don't lift the leg. Okay, it's not going to work. Yes, please. Heart of soul. Both sides if possible. Okay. How's now?
Maybe a little less, but it's so, very tender. So.
Try changing a little bit. There's a possibility still. Move slightly up. Yeah. And also press towards you rather than upwards. Okay.
So tiny, maybe that helps a little.
Okay, hold on. Don't move. You can move this one, just let go of this one. Okay.
Would you have to direct moxa
On the pain area? No, because very possible for it to get, that's really asking it for it to get worse, possibly.
Do you think this could be maybe counter-coup? Kind of,
No, because it's not a head injury.
but wasn't it occiput, or is it just...
No, this concept of, contra, whatever it's called. Yeah, that you get hit here and it's going to show here because of the brain went, but there's no brain involved here. She's in the neck. I mean, we don't know that there was an actual, like head injury.
Around in bed and maybe...
Yeah, it's part. She whacked herself against the wall. It's possible. No, I guess it's part.
No, I don't think that's possible.
No.
Where I was, I woke up in the middle of the night with, my head was paining me. I had like a headboard. I think if I'd knocked my head, it would have woke me up. Nothing off.
Just have that chin point that...
Yeah, we could try. Wait, something's wrong here. This is the left side. This is the right side. Okay. No, this is the left side. No. Hold on. I'll tape it in a second. Actually, it seems to be holding.
What is this?
They're rings, and is that okay? Not bothering you?
No.
All right. Oops, sorry. Is it okay now?
Yeah, it's a little heavy, but...
It's a little heavy. Okay. How about just this?
Yeah, I just felt tolerate that.
Okay, forget it. I'd rather. Okay. Let's keep trying. Because she also has this like kidney hump, this hump, which means that there's no, you see this? There's no way she can get circulation into anywhere. Okay, so this is okay, I'm allowed.
Yeah, I get a lot of tension.
Yeah, I know you get, yeah, I'm sure you do. Okay.
That's C7 now.
Yeah, that's, hold on, that's buffalo hump treatment. They really want you.
It's probably the gap insurance from my car.
Well, they're going to have to call back, unfortunately. Anything here? Or more here?
No, that's
Sorry?
a little, yeah,
Okay.
yeah, a tiny bit there.
Anything?
Tiny bit of more there, yeah.
More here. Okay. So this is Kawai's buffalo hump treatment. Okay. So it goes with Apache. So there's two, it's each side has a triangle.
You wouldn't do it without.
No, it doesn't. It's not. Well, you could try, but it's really it's the sparking of it that's going, you know, hopefully produces what you want. So
Unless it's because the other things haven't proved.
yeah. Oops. Hold on. Yeah, since you know. Well, but and yeah, I'm hoping that if the buffalo hump clears, then maybe the rest of the neck will start to get better. Okay, so I do gallbladder 21 and small intestine 13 area, and then I'm sparking the. That feels a little electrical, doesn't it?
Mm-hmm.
Okay, was it okay?
Yeah, fine.
Okay, good.
So you've sparked C7?
The C7 Watto. I needle into the buffalo hump downwards. I'm basically trying to get the fat part of the buffalo hump. I'm trying to get through to it.
Yeah.
Now, wherever I had the green clip, here I had gallbladder 21 red clip, so the green clip on the other side goes on gallbladder 21, and small intestine 13 will get the red. And there's a bunch of different points you can use for the buffalo hump, but ultimately the buffalo hump itself gets done. So you can use other remote points for it.
Red one
Must be
side
and
reverse it on.
yes, that's exactly it. Sorry. Okay. How's now?
Yeah, it started.
No change.
No.
Oh. All right. No change.
No.
All right. We'll let you just relax for a little bit, and we'll be back, okay?
Yeah.
All right. You're welcome.
And the dials on the fingers? What?
Okay, middle finger for autonomic nervous system, and little finger for the location on the neck. You know, Taiyang, small intestine, right?
It feels comfortable at the moment.
Okay, and how's the knee?
The knee needs a little bit of exertion before I can.
Oh,
Yeah.
okay, gotcha.
Yeah, it's you know, there's pain in here.
Mm-hmm.
When I can walk upstairs sometimes 2 at a time. I can get myself off the floor with the left leg, but if I bend the left leg and then try and straighten it again, it's really painful. In fact, it gives way sometimes, and it gives way when I'm walking sometimes.
Okay, got you. Let's put your face down. Is that going to be okay?
Yeah. Oh, that goes right up.
Oh, sorry?
That goes through the hip and right up the body.
Okay, so when I press here, you hate that.
Yeah.
Okay, got you.
Yeah, sure. I've had lower back problems all my life, so.
Okay. This one's okay though.
Yeah.
Okay. How's that?
That's fine.
Okay. So sacroiliac. Now for the eyes, sorry?
D2 produce that pain.
Yes. Yeah. Okay. So this shoots, right?
It's not at the moment, no.
How about here?
Yeah, it's beginning to.
Okay. How's now?
Fine.
It's fine. Okay. Gallbladder 39. Yeah. All right. It's okay now? All right. I'm still not going to needle it, but. So T11, T12, same old story sort of thing. Now, these spots on the back, you had them as a child or they came up at a certain age?
I would imagine they just appeared up because I could never see them. It was only once when I was staying in a hotel that there was a double mirror and I saw that they were covered. Well, I spent 2 years in the sun in Bahrain. So,
Okay. Now, anything 1, 2, 3? No. Okay. But remember, I thought liver on the front, and he wasn't able to distinguish, and again he can't. But since here I don't have to, I only have one option, which is UE35. I can just go for it.
The angle of the sort of sacroiliac needle seemed perpendicular.
Yeah, you're aiming to do this. So in this case, this needle, it just didn't happen because of the ligament is stronger than you. But this one happened to have worked out.
Okay.
You're aiming to go towards opposite gallbladder 26.
It's just the tension sometimes.
Yeah, the ligament is usually stronger than the needle, unless you use a thicker needle.
What, T7 quarto?
T7 and T5, yeah.
T7, T5.
Okay.
Why are you starting off with the sacroiliac?
Because to release the spine.
Right.
I mean, the treatment on the back is basically release the spine, therefore to release the nervous system. As a sort of dogma.
Even though he hasn't got, didn't.
No, but I'm trying to open up the spine to open up the nervous system. So I mean, it's kind of a universal thing that you're trying to do for everyone,
So you
regardless.
Sacroiliac in kind of.
For a lot of people, yeah. I mean, you can pretty much, you also activate the parasympathetic plexus that's behind the sacrum, or in front of the sacrum rather. So it's that's what I'm trying to express is that the back treatment is almost universal. They're all very, very similar. You're not going to see, there's a little bit of variations in it, but you're going to see almost like a kernel of the same back treatment constantly. Yeah. All right. I'm going to spark you once more. Is that okay? Mm-hmm. All right. Is that okay? Mm-hmm.
Fast pulse, you would avoid needling the portals of the spine.
No, I know exactly what you're talking about. And okay, the theory about fast pulse, rapid and slow pulse is a little confusing. Okay, so basically slow pulse is very clear. You do not needle the abdomen. Oh, you have a cramp? No? You just feel like moving your foot. Okay. With slow pulse, you don't needle the abdomen. That's clear. The problem is there is no clarity about what you don't do on the back. Okay, at different periods, different versions of this came. So you suppose, because it started with you don't do the spine for rapid pulse, but then we're always doing T11, T12, and we're always doing T5. So it kind of like became like, but not in between and not, you know. So it's really not clear what you don't do for rapid pulse in the back. And I once asked Kiiko very directly, because the slow pulse I understand. If you stimulate the lower abdomen, okay, like you breathe into lower abdomen, it slows the pulse down. Slow pulse, you do not want to slow their pulse down. Okay, rapid pulse, you want, you know, like, you know, it sounds like a good thing, slow the pulse down, but there's at a certain point it becomes, you know, like it's too slow. Okay, so I asked Kiiko, like, you know, how did Nagano write? She said, I actually don't know. And she said, you know, sometimes you have a patient, you know, and something catastrophic happened, you know, at the beginning of your career or whatever, and you had a patient and something horrible happened, and then you'll never do that again. So it's possible that Nagano had, you know, in 1951 or whatever, he had a patient with slow pulse and he needled the abdomen and the patient went berserk, or rapid pulse, you know, like, so he created some rule. So the rule for the back, in my opinion, it is not as applicable as the rule for the front. You know, what I can say is that with slow pulse, I'm emphasizing the back more, and with rapid pulse, I'm emphasizing the front more. And so, you know, with rapid pulse, if it's extremely rapid, I may do a little, you know, I may kind of restrict myself into what I do on the back. I'm not going to do huge amounts. And then there started to be this thing about, well, you don't need do not needle the center, but you can needle on the sides. For example, with slow pulse. You know, because over time there are more and more, you know, when I first started this, we never needled abdomen, ever, okay? And then suddenly there's all these protocols, you know, like, oh, right stomach 25, you know, right liver 13, and then, you know, some smart-ass person says, well, what about if they have slow pulse, you know? And then it goes, well, yeah, do not needle the center in slow pulse, but if you go to the sides, it's okay. You know, so it's one of those things. Take it as possibilities, but don't assume that it's 100%. You know, that it's 100% foolproof. Does that make sense? How does it feel right now? The neck.
I'm always worried to move it about
Yeah.
too much.
Well, don't move it too
know.
much. Just so, you know, to the extent that you're comfortable. Do not overdo it. Okay.
It feels a little tight on. I don't know if that's just the way I've been laid.
Mm-hmm. Okay. I'm not going to.
That's just a little bit of the lump, as I call it, on my back.
Meaning this one.
Yes.
Okay. Yeah. Well, it's been activated a fair amount. So, okay. So I'm not going to do the stretch that I normally do, because I don't want to create, you know, create extra problems. Turn your, okay, before we start, this will feel electrical. The muscle is going to jump on its own. Okay, you just as soon as, if it's totally intolerable, you just say, and I stop. All in all, it will last 3 or 4 seconds, so it's not. But it will feel a little bit like a cattle prod, possibly. Okay?
Right. That's made me nervous.
Don't be nervous. It's really okay. Now, we're talking about a cattle prod with a 1.5 volt battery. You know, so it's not like, you know, we're not talking about 300 volts or something.
Okay.
Okay. No, the muscle's jumping. That's why it feels so weird. Because, you know, why is my muscle twitching? Okay. So turn your head and look slightly to the left. That's good enough. Okay. Here we go. Relax if you can. Yeah, I can't make a jump anymore. Now you're holding. Okay. Can you relax here? Okay. I'm going to try once again, okay? Turn to the left. That's enough. Yeah. It's that first jump that I was looking, you know, I was hoping to get more. Okay, turn to the right and see if you can, okay, drop the head, yeah, that's good. Okay, let's see.
Oh,
Okay, done.
that really moved my shoulder.
Yeah, that's, okay. Now, so drop the chin slightly, look slightly to the left. No, yeah, that's it. Drop. Okay, that's good. Let me see if maybe I can do it. No, this side's... Okay. How does it feel? You can relax. How does it feel now?
I don't know. It's maybe a little bit less tight in that middle bit in the back.
In this
Because
part?
that was very tight when I
Right.
first got up.
Okay, but the part in the neck?
It's hard to say if there's any difference.
Okay.
I've had it for such a long time.
Yeah.
You know.
Yeah.
I'm nervous at moving my... Obviously, I do move my head around. But I'm always wary of what I'm doing with my head.
Yeah. Okay, how about you trying touching?
It's maybe a little less sensitive now. Yeah, probably.
Okay, give me one more try.
But it's still very, very,
Yeah.
very, very tender.
Okay, go ahead and touch again.
It's still very tender.
No change.
No.
All right. Sorry.
No, that's okay.
All right, well, thank you for coming.
Yeah, thank you very much.
Thank you.
Thank you. So, Avi, would you suggest that this lady would come again and you try some different approaches? What would you
Yeah,
what
I
would you
mean,
suggest?
just because I always, first time, if you fail, the problem is the patient.
My back feels a lot easier.
Yeah.
My back definitely feels a lot
Yeah.
easier, but
The neck is,
it's a big problem, I understand that.
Yeah. What I suggest to patients is, first time, thank you so much. First time patient, I usually say, even if it's like looks like a total failure, I say, let's try again. But if second time still total failure, if they want to come, I just don't say anything at that point. I wait to see what they say. Because if I say, oh, do you want to try again? It's like they think, oh, I just want their money. If I say, oh, we failed, it doesn't look like it's working, sometimes people come after 5 or 6 or 7 or 8 times. It's rare that a patient's willing to do that, but every so often I get somebody who does, and suddenly it starts getting better.
But would you think with the fact that it has been such a long time...
That it's supposed to take time.
It's not going to be a miracle, is it?
No, I know, but I want to see some movement. So the thing is, well, it's not about me, it's about them. That's what I'm saying. I'm trying to be considerate of what it feels to them like to have to keep coming back. So if they got some movement, it's like, well, yeah, of course you tell them come back. But if they got like this is not doing anything, and they're disappointed because they just wait, they spend X amount of time to get here, they spend X amount of money, and at the end of the first treatment, you say to them, well, let's try one more. Maybe this strategy wasn't the best one for you. There's also the possibility that overnight things will shift, and suddenly tomorrow you'll wake up and, oh, gee, suddenly the treatment was garbage, but suddenly the next day it seems to work. So there's no guarantee that the treatment was bad. Right. But we're not going to know until next week. And then if the treatment wasn't good, next week I'm happy to try a new strategy. However, how many times can I try a new strategy? Okay, so for me, personally, I am happy if they come twice, and if after the second time there's really no movement, I am not doing anything to encourage them to come. It's always their decision, but in this case, it's like it's their decision with zero feedback from me that they should come. Because it's not, I don't know what else I'm gonna, it's like you try twice, and then sometime if overnight I'm gonna go, wow, I should really try this. I'll call them and say, would you like to come? I have a new idea, and I don't mind doing that. But to just tell them come 3 times, 4 times, it's gonna take time. Is a good phrase, so to speak. If you see a little bit of movement, back, but yeah, I know.
So that's part of, part of
Oh, I'm not. That's why I'm not saying anything about it. I'm not saying I wouldn't. I would totally tell her to come back.
Yeah,
but how's the neck?
At the moment, it's great.
Well, thank you for coming.
Thank you very much.
Nice.